Hello everyone, welcome to Virtually Visit Cleveland Clinic. My name is Bingqi Guo. I am the director of the Physics Residency Program. Today I would like to give you a brief introduction of our residency program. The Radiation Oncology Department at Cleveland Clinic has main campus and 10 regional centers. 8 of them are in Ohio and 2 of them are in Florida. We have 16 physicians and 11 physicists at main campus, and 18 physicians and 16 physicists in the regional centers. All physicists are involved in residency training. Ping is our chief physicist. I am the residency program director. Alan is our expert in brachytherapy. Matt is mainly in charge of dosimetry training. Anthony gives residents orientation in their first month and also in charge of the SBRT rotation. Gennady is our expert in gamma knife. Peng would be mainly in charge of QA rotation and special procedures such as total body irradiation and total skin electron therapy. Nan Chang would be mainly teaching imaging. Lan, Yongbin, and Jay Wook are also physicists in the department who would work with residents. Andy is our radiation safety officer, so he would teach residents the radiation safety aspect of the training. Mike is a physicist at Hillcrest. In our training program, we have 6 months of regional practice where residents would be working at Hillcrest with Mike. Also, we have 2 physicians in the residency steering committee, Aaron and Shrug. We recruit 2 residents per year. There are currently 4 residents in the program. Alex will graduate this year. Saeed, Ho-Hei, and Tara will graduate either next year or the year after. Alex and Ho-Hei are 2-year residents, and Saeed and Tara are 3-year residents. We do offer the option of a 3rd-year research for those residents who are interested. The residency program has graduated 18 residents so far. As you can see, they are scattered out in the world, although most of them are in the east side of the country. Of the 18 graduates, 11 of them are working at academic institutions, and 3 of them are actually working at the Cleveland Clinic, and the rest 7 are working in clinical positions. Our main campus site has 6 variant linear accelerators, 4 true beam, and 2 edge machines. We have a variety of IGRT equipment, including OSMS Vision RT, 4D cone beam CT, dating, and intrafraction motion monitoring using KIM and Clarity. We have 2 CT simulators with 4D CT. We have an MRI simulator, which we jointly own with radiology department in Cleveland Clinic, but we have our designated time slots for radiation oncology patients. We have a gamma knife icon and brachytherapy, including HDR, LDR, intraoperative radiation therapy, intravascular brachytherapy, iPlaque, and the Therasphere. Our regional centers have variant Siemens linear accelerators. They also have a gamma knife and HDR, LDR brachytherapy. We use Pinnacle for external beam treatment planning in main campus and the regional centers. But we also have Eclipse and the Ray Station for research. We use Mosaic as record and verify system in all centers. MIM is our contouring and image registration software. For gamma knife, HDR, and LDR brachytherapy, they have their own treatment planning systems. The residency training includes 2 full years of clinical training. 1 month would be introduction, 6 months of external beam treatment planning, usually 3 months of 3D planning, and 3 months of IMRT, VMAT planning, 4 months of SBRT, 4 months of brachytherapy, 6 months of regional practice at one of our regional centers, 1 month of gamma knife, and 2 flexible months for residents who are particularly interested in a certain area or to make up for the other modules. Besides main training modules, there are a few ongoing modules in residency. Our residents are responsible for patient-specific IMRT QAs. They share the duty of linear accelerator monthly and annual QA with physicists. Usually one machine would have monthly QA by resident 1 month and physicist another month. In their second year, they would share the duty of chart checks with physicists. And they are encouraged to participate in clinical improvement projects throughout their residency training. The residency program have a few specialized modules too. Residents are responsible for in vivo dosimetry in the department using MOSFET or TLD. We have total body irradiation and the total skin electron therapy program, which residents would help physicists to do necessary QA and planning. The linear accelerator acceptance and the commissioning part is a question that we get a lot. Our main campus won't have any new machine in the near future. However, we have quite a few regional centers who would be replacing their old machines with new TrueBeam or Halcyon machines in the near future. And we will send our residents to the regional center to learn and help with commissioning them. We have intraoperative radiation therapy, intravascular brachytherapy. Our radiation safety officers would help us teaching our residents in radiation safety. And our residents would learn the diagnostic imaging equipment QA with the people from the diagnostic department. There are plenty of clinical educational opportunities in the residency training, including the morning conferences and chart runs. We also have morning lectures that are taught by physicists and physicians in the department. Every 2 weeks, our resident and the resident from our neighbor UH would have a presentation on TG reports. And we also have a bi-weekly research seminar where resident and the physicists will present recent journals. Research is strongly encouraged for all physics residents, whether they are 2-year or 3-year. We support our residents to attend the regional and the national meetings at least once per year. To summarize, I think one of the main strengths of our physics residency program is the broad scope of our practice. We offer a wide variety of treatment techniques to our patients. We are a team working closely with each other to improve safety and quality. There are a few unique features of our program. We have an extensive treatment planning practice because we believe treatment planning is an important skill for medical physicists. We are one of the few centers which offers Gamma Knife certificate course. This is a requirement for anyone who wishes to be authorized medical physicist for Gamma Knife. There are many clinical educational lectures, seminars in the department. We also have fun activity. So the picture is me riding my bike for Verasano. Finally, we are continually looking at our residency program, making improvements from the feedback from our residents. So thank you for your attention. Welcome to ask us questions when you virtually visit us.